County regular Piqua City Commission meeting. We'll start by saying the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Next, can we call the roll, please?
Mayor Lee.
Here.
Commissioner Hines.
Here.
Commissioner Grissom.
Here.
Commissioner Pearson.
Here.
Commissioner Foat.
Here.
All right. First on the agenda tonight is consent agenda.
Yes, we have one item on the consent agenda. It's the approval of the minutes from the June 2nd, 2020 regular city commission meeting.
I make a motion we approve our consent agenda.
Second.
Moved and seconded. All those in favor, please say aye.
Aye.
Opposed? Motion passes. Next is on to new business. It is in reference, the first thing in new business is ordinance number 7-20, a first reading.
An ordinance to vacate a portion of public alley right-of-way.
Mr. Smeezing will be giving the staff report for the next two items.
Thank you. The item that we have before you currently relates to a portion of unimproved public alley right-of-way just south of East Main Street, east of Staunton Street, alongside the Central Baptist Church. The area of right-of-way in question has never been improved. That is, when the development of the subdivision occurred originally, that segment was never paved. So it's platted right-of-way, but it's not improved right-of-way. The adjoining property owners over the years have expressed concern about the condition, the overgrown vegetation, and the unruliness of the area. There's a fairly steep slope, so it's difficult to mow and maintain. More recently, the one property owner approached us and expressed an interest in owning the property should we be willing to vacate it and clean off the vegetation and make it easier for them to maintain going forward. So we're happy to accommodate that request. We have brought the item before the City Commission to declare your intent to vacate the right-of-way as required by the ordinance or the charter. Advance the item to the Planning Commission for a public hearing on June 9th, at which there were only one person attending who spoke on the item. That was the representative from Central Baptist Church. And they were positive towards approving the vacation. They were supportive of it. As was the Planning Commission, who recommended the vacation move forward. So now the item is brought back to the City Commission for the formal action of vacating the right-of-way. If you all would be supportive of this request, staff would then proceed with preparing the survey plat that's required to formally vacate it so that it can then be recorded and the property can be transferred. Knowing that there's been very little comment from the public, I would suggest that waiving the three reading rule might be in order on this item.
Any comments from the commission?
It looks really good.
Mm-hmm.
I mean, driving by it and with the pictures, I mean, it looks really, really good.
Go ahead.
I was going to say, and we've talked about this multiple times already, and I'm okay with waiving the three reading rule.
That was my question.
I'll make a motion.
I'll second.
All right, motion to waive the three reading rule. All those in favor, say aye.
Aye.
Opposed? All right. Three reading rule has been waived. Any other comments and references?
For me, I just want to say thank you to the city and the staff for getting that cleaned up. I drive up that hill on a daily basis.
You do.
And, coming around by the hazard light now, seeing that the trees that have overgrown that place just completely wiped out, it just smile on my face all day whenever I'm driving up that
Looks
hill.
good.
So thank you guys very much.
That's good. With that said, I'll entertain a motion.
I'll make a motion to adopt ordinance number 7-20.
I'll second.
Can you, on ordinances, we poll each person individually?
Not normally.
Normally?
Roll call.
Okay, all right. Commissioner Hines.
Yeah, aye.
Okay, Commissioner Grissom,
Aye.
Commissioner Pearson,
Aye.
Commissioner Foat,
Aye.
Mayor Lee.
Aye. Motion passes. Thank you very much. We'll move on to the next agenda item, which is resolution number R-87-20.
A resolution requesting authorization to accept a sanitary sewer easement on the property located at 8515 Industry Park Drive.
This item relates to the 112,000 square foot industrial flex building that's being constructed at the end of Innovation Parkway that I've mentioned before. The developer, in their planning activity, looking at possibly doing the project, identified a manhole to a sanitary sewer line that was immediately to the north of the 8 acres they're building on, which actually, it's an 8-inch line, and it travels across the adjoining property, which is Hobart Corporation. And communicating with Hobart, they are very receptive to the idea of our simply taking over that 8-inch sanitary sewer main, which would then, it's what in part allows the project to go forward. Otherwise, we would have about 600 and some feet of 8-inch sanitary sewer that would need to be installed to Industry Park Drive to be able to service this site. So by accepting the existing pipe that's in the ground across Hobart, not only are we minimizing the cost associated with allowing this development to go forward, we're doing the right thing here in terms of helping out our industrial community. So it's staff's recommendation that we approve the easement. Hobart is currently reviewing the document, so the final document would be substantially as presented in the packet here this evening.
Thank you. Any questions from the commission? No questions, I'll entertain a motion.
I move that we adopt Resolution R-87-20.
Second?
Moved and seconded. All those in favor, please say aye. Aye. Opposed? Motion carries.
Thank you.
Thank you very much.
Thank you.
Nice and painless, huh?
Yeah.
Very good. All right. Next is the public comment section. It's an opportunity for citizens to address the city commission regarding agenda items, issues, or to provide information. Comments are requested to be limited to 5 minutes, and specific questions should be addressed to the city manager's office. Today, there are no questions at this time, so we will move next on to the city manager's report. And if you'll notice, the city manager is not here. Our current city manager, Gary Huff, has announced his retirement effective June 2020. I wish him well. He's done great things for the city. I appreciate his calm and steady and guiding hand. He's done a great job for us and led us in the right direction. And we just want him to, thank you, be able to relax and do the things he wants to do in his retirement. So, but in his stead, we have the assistant city manager here for the city manager's report.
Thank you. I'd like to welcome our health director, Amy Welker, who will be giving a public health update.
Good evening, Commissioners. Mayor Lee, thank you for having me tonight.
Thank you.
I'm going to be addressing a topic that's very broad, and this is just going to be the very tip of the iceberg and just really getting a conversation started. So tonight, we're going to talk about racism a little bit, and recently, there's been jurisdictions in Ohio that have taken steps to proclaim racism as a public health crisis or a public health concern. And so I know that there was some commissioners that were interested in learning a little more about what that entails and what that means and kind of where we're at in Piqua on an issue like that. So I'm just going to present some information about that, just hopefully to get a dialogue started, and then kind of turn it back over to the commission to maybe discuss a little bit of what your future looks like in terms of this topic.
Thank you.
So where I'd like to begin is just with a little understanding of the term health equity. When we talk about health equity, it can be very basic in just that it's that everyone has the ability to achieve their full health potential. And when we look at that, unfortunately, in the country and specifically in Ohio, there are large gaps in health outcomes amongst our citizenry. One very specific example of that would be that there is a 29-year gap in life expectancy among Ohioans based on where you live. So, for example, if you live in a certain neighborhood in Franklin County, which is where Columbus is located, your life expectancy is 60 years of age. Conversely, if you live in a neighborhood in Summit County, where Stowe, Ohio is the biggest city, your life expectancy is 89 years. So a difference of 29 years. So when we talk about health equity, that one statistic alone tells us that we're not equal when it comes to health outcomes. So when we look at an individual's health, there are many factors that go into determining what your health outcomes will be. Research shows that about 20% of your health as an individual is dependent upon your clinical health care, the care you're going to receive from doctors and other medical professionals, only 20%. 30% is going to be based on your health behaviors. And your health behaviors would be things like if you choose to smoke or if you choose to exercise, those types of things, which can be very dependent upon the next category as well, which is 50% of your health status is dependent upon social, economic, and environmental factors, which we term as social determinants of health. Things such as your economic status, your education level, the physical environment in which you live, including housing, your access to healthy foods, your access to health care. All of those social things have a very large impact on your health as an individual and as a community overall. So I provided for you, I wanted you to take a look at, this is just one document, and I wanted to say that I'm basing a lot of my discussion tonight off of research from the Health Policy Institute of Ohio. Earlier last week, I provided you with a document regarding health disparities related to the COVID outbreak and how that has been a factor determined upon race. And so this continues that discussion and from the research from the Health Policy Institute. And I'll provide these documents on our website for the community to take a look at as well to see where I've gathered this information for this discussion. But just taking a look at this one equity profile, which profiles differences between Black Ohioans and white Ohioans, you can see in the chart, when we look at socioeconomic factors such as, for example, adult poverty, Black Ohioans are 2.5 times worse off in that category, which we know poverty then also equates into health factors. Community conditions, similarly, take housing, for example, 2.3 times worse for Black Ohioans as opposed to white Ohioans. When you look at health care, prenatal care, for example, 1.7 times worse for Black Ohioans. And then you get to the bottom of that chart, which you look then at health outcomes, and we know that take infant mortality, for example, it's probably one of the worst examples in Ohio of a disparity where Black children are 3 times more likely to have to die in the first year of life as opposed to a white child. So when we're looking at these disparities along racial lines, it can be quite difficult to explain because race in and of itself has no biological basis to account for these differences. So what you're seeing now from communities and researchers in the field of public health is taking a deeper dive into what is the cause of these disparities. And over 100 studies recently have determined that racism is at play here. So, we're trying to determine, how does this affect our community? And one of the things I would mention is that here in Piqua, it's a little more difficult to look at some of these issues on a city level because, quite frankly, the data is not there. We do have some data sets on the county level. We have some data sets related to census tracts.
And demographics, right?
Yeah, and demographics, of course. But looking specifically at health outcomes, we don't always have a lot of data to look at disparities. We do a community health assessment every 3 years in conjunction with our community and Miami County partners. And our most recent health assessment, we did take a look at social determinants of health, but again, it lacked some data on race specifically. So that's one area that I think to the future we can look at. Maybe we need to incorporate some new data sets or create them in terms of how do we look at that issue. And we could do that through that process of our community health assessment. So that's certainly something that I'll be pushing for on our next assessment is how do we get some better data. So, as I said at the beginning, this discussion on racism, I'm just touching the very tip of the iceberg here and wanted to explain a little bit of what that meant when you see a community declare racism as a public health issue. What they're looking at is all of those social determinants of health and how those disparities are in play in a certain community. So certainly, this, I think, will open up some dialogue in the community, and I know that there are certainly a lot of voices out there that would like to be heard on this topic, and I know that there's been some discussion of reinvigorating the diversity committee, so that's obviously a possible outlet to maybe foster some good communication, take a look at policies in place. What type do we have a problem with systemic racism in our community? Is there opportunities in our community to look at individual biases and things like that perhaps through the committee we could offer education and different things, to at least get the conversation going. Piqua kind of, I think, is in a very unique situation right now. Obviously, with our first African-American mayor sitting in that position who also has a very unique background in law enforcement. And a lot of this discussion and heightened awareness around this issue has been brought about by law enforcement issues throughout the country recently. And so I think that as a community, Piqua is very well situated to be a leader on this topic. And, I would certainly like to keep that conversation rolling in whatever way the commission would like to move forward. So my role here tonight was really just to kind of explain what that meant in terms of public health's involvement in the topic, and then just encourage the commission to move forward in whatever way you feel is appropriate to continue that dialogue.
Well, I can tell you that the interest in the community diversity program was spurred by me like 3 months ago, before any of this stuff started happening. I mean, I wanted to bring that back because being an African American, being in law enforcement, and seeing the disparities, I wanted to bring about some awareness. One of the things I would like is if you could be an advisor to that committee. You know, if they need you to come in and give them information, would you be willing to do that?
Absolutely. I would be very appreciative and happy to be a part of that discussion.
And then next, my recommendation would be to come up with a resolution to present to the commission at the next commission meeting so that we could decide if we do want to approve a resolution to declare racism a health crisis in Piqua.
And Mayor Lee, if I can just say a few
Sure.
things about that. I was in discussion with Lisa Baker at the YWCA. They have done some great work around racism, and there is a 21-day challenge that was created by a Dr. Eddie Moore, and many places are using it. The Y has used it and kind of made it their own. There's a church, our church, the church that I serve, we are working on this challenge as well. It's a fabulous challenge of trying to get some perspective for what it means to be of a different race other than white in our country, because you did an excellent job too, Amy, of explaining
Thank
this.
you.
So
Oh, you did.
Thank you. It
You
was
did.
very, very good. And the reality of what this, and to get this on the city website, the reality of the disparities. My husband and I lived in solidarity in the poor with Atlanta, in Atlanta, Georgia, many years ago, and what meant that we had to take public transportation. We had to go to Grady and stand in line for 6 hours to get our medicine filled in order to see a doctor. And if you are of a socioeconomic, that you have to work, but also need to get medical care, many times work is what you do because you can't get medical care because you've got to make money to put food on the table. So it is something that unfortunately I think COVID has really exposed for us as a country. And it's really brought to light a lot of inequities that we have. And I, for one, am, again, so thankful for Mayor Lee and what he brings to the table. And I think for us as a commission as well, as we look at this, and I know Montgomery County just today did declare racism as a health crisis. I know that the state has been looking at it. I'm not sure where they are on it. Sometimes they don't move so quickly, but I'm thankful that we're having this discussion.
Anybody else?
Yeah, I'd just like to ask, you talked about, substantial data being out there. And Mayor Lee, thank you for bringing this conversation to light 100%. I want to help support that. When we look at the bigger communities where some of these statistics are able to see, are there metrics that are out there that we could actually try to start putting in place now to see if we can draw that community data down? And also, is there opportunities to deal, we set very well here in Piqua alone because we have a great Head Start program. And, the Head Start program is driven from the lower income, lower social status people that are in our community. So is there any way that partnership we could work through as a city with them to help gain some of this data that would start setting the basis for the younger generations that are going to be coming up, but not forgetting the older generations that are already here?
Yeah, those are great questions and great comments, because I think one specific point you bring up is that we definitely need community partners, because this is an issue that would affect the whole community. So we need to hear from agencies such as Head Start and the YWCA does great work on this topic. So we certainly would need to incorporate all of our community partners, and there's definitely work that we could do to garner some data that would be needed to take a more in-depth look at some of these things.
Great, thank you.
I do know in talking to Lisa Baker that the YWCA is planning to put some things together to help educate the community and because that's what they've done, and to possibly even look at the 21 challenge for us as a community, so.
And that sounds like something that we should get on board with, something that I would advocate. Also, I'm working with the city manager, and I'll be working with the law director on the community diversity program. We wanted to bring it back, but not in the way that it was before. We want to add more members to it. We also want to change its focus. One of the things that it could do is partner with you, Amy, and you can tell them what kind of stuff that they need to look for and reach out to the different community partners and get the data so that we can have the information so that we can look at it, make it Piqua-centric.
Right.
This is what is going on in Piqua. So appreciate your willingness, and I appreciate everybody's involvement. I will have a resolution at the next commission meeting, and hopefully we can pass that. To me, it's important. I know a lot of people don't have to tell their kids when they're growing up, be careful when you go out, if you get stopped. And being a police officer, I'm still telling my kids, if you get stopped, this is what you should do. And we had an incident with my oldest son. He got stopped in Wapakoneta, and he listened to what I said and the directions, and he got through it. But he was pretty heated because of how he was treated, which wasn't the same. And I was like, and being a police officer, I know that probably wasn't the right way, but that's what happens, and it's the cost of being black, basically. And my dad tried to warn me. One of the things on the equity profile paper that you gave us talks about Jim Crow and redlining, and my dad used to tell me about it when I was a kid. And living in Piqua, I didn't believe it. I honestly didn't believe it because I felt like everybody else. But he said, you're going to experience it. And at one point in time, I did experience it. And then I moved to Dayton, and then I really saw it. So and then I ran back to Piqua because Piqua's home, and it's a lot safer. And you don't see a lot compared to Dayton. But, it needs to be brought out. There needs to be some awareness. And I know there are people in the community. There's a lot of people in the community at this point that want to help and do something about this. So we'll work on that. And I appreciate you coming and educating us. So
Chris, can I just make one comment about diversity? Because obviously we have other citizens in our community that may be Asian or for whatever reason are diverse from the whatever you want to call. And so as we think about diversity, I want to make sure that we think about including all of that within that. And I know the schools have done a really good job of this, and I think that they may be a great partner for us. I know they had some diversity training this past week, but they've done a really good job at the high school, I know.
Edison State has a good diversity committee as well.
And Marva Archibald at Edison State too, so, yeah.
And that's one of the plans is UVMC has a great diversity program as well. So the plan that I had in mind for the diversity, and I was going to get to that as well the next commission meeting, is to network with those programs. Upper Valley has one. Upper Valley UVCC has a diversity committee. Edison and UVMC, get with all of them and be a network so that it's a strong presence in the community and we get help from a lot of partners. So very, very good. And it's not just, diversity is not women, Asians, all different races and genders. So, but we'll work on that. And I appreciate you coming.
Thank you.
Okay. Anything else for the city manager's report?
Nothing else to report, thank you.
I did have a question for the city manager in reference to the utility billing for the flat rate versus the prorated fee. I had a person ask me the question, and I asked if you could do a study, and
We currently have a study out there. We're expecting to have more information back towards the end of this month, so I hope to be able to report kind of what the consensus is within the utility area next month.
I appreciate that, and you could tell us about all the problems and issues and what it all entails at that point.
Okay.
I appreciate that. Thank you. Next would be commissioners' comments, and we will start with Mr. Foat.
Really don't have a lot to say, just want to follow up and make a request tonight. Last meeting, I talked about the trash trucks going up and down the alleyways. I think we need to keep this thing alive as much as possible. So going back into this conversation, request-wise, I don't know if it is at all possible to actually break down the percentage of monies that we have that go into alleyway repaving out of our annual budget for repaving citywide. If there's a certain percentage on that, how that's identified, it still goes back to it that if we can make things better for the city, that's, I would assume that's our job up here as the setting commission to ensure that we're improving the city in all ways possible. And of course, as we move towards the future of bigger trash trucks, this is a true study that needs to be done. This week, I drive around town pretty regularly, driving from school to school, and I seen a trash truck that had to back up 3 additional times in an alleyway to make a corner. I know that that's no good for our alleyways, that you have a 12-ton truck that's having to back up, stop, drive forward, stop. That's going to continue to move that pavement around. So if we could get a study percentage rate together as to what we're actually putting into our alleys out of the paving budget, I would greatly appreciate that.
Amy, is that something that you can do?
I think Brian would probably have information in terms of what our expenditures are like, alley versus street, but I certainly have been looking at that issue as well in terms of the
That's
trash.
what I was thinking, and one of the things that I was thinking is that at some point in time, we're gonna have to put the trash cans out in front anyways, right?
It would be our plan, once we go automated, that it would
Yes.
be likely that most would have to go to the street. There's always going to probably be a certain few areas in the city where it doesn't make sense for a variety of reasons. So we'll always probably have some alley pickup, which we'll do with a rear loader. But the bulk majority, we would like to move out to the street.
And it would save the alleys ultimately.
It
wouldn't
certainly would save the alleys. They're not
sure would.
really designed, like you said, to carry the weight of those trucks. And right now, we're actually looking at the alleys where we do have to back into and looking at maybe going ahead and moving out of those alleys now, just because it's hard on the alleyway, but it's also hard on our drivers, and it causes backing is always a dangerous thing to do. So
Is there a time frame for when when you're gonna go fully automated?
well.
I know, I'm sorry.
Yeah, so our plan was, if you remember,
I do.
was to do the building first.
Yeah.
And so we're looking at that project
Okay.
in light of everything that's going on. And if we can move forward with that project, we would like to do so. And then, look at starting to convert over the trucks.
Hey, I appreciate it. Thank you very much for telling, and Mr. Vogt, thank you very much for staying on top of this. Bring it up often and we'll stay on it. I'm in agreement with you. I want to save the alleys. They just patched my alley, so I'm very, very happy. I didn't beg or ask. I was like, oh, geez, I can drive down the alley now, because before I couldn't. And it's because the heavy trash trucks are tearing it up. And it's that repeated having to fix it. And if we can reduce the time between us fixing it, we could save ourselves some money. So that's a good idea. Appreciate that. Anything else?
No, the only other thing that I have is look forward to hearing from the medical board tomorrow evening on the medical marijuana dispensaries, grabbing that substantial data so we can move forward with a plan of talking about it further in the city. So
What time is that?
6 p.m. And that's a Zoom. The public notice went out, and I know that there was verbiage in the public notice saying that if the citizens wanted to have access, they would be able to have access, but it would only be listen only. They would not have the ability to speak during that meeting. So I encourage that if you guys want to listen in.
Oh, I'll be there. That sounds good. Thank you. Mrs. Pierce?
Thank you. I was opened up an email the other day, and it was from Chris Schmeezing, and it was the Wright Dunbar Incorporated announced the 2020 Dayton Region's Walk of Fame inductees and the postponement of the inductee luncheon due to the virus. The Walk of Fame induction class of 2020 offers a first-class mix of individuals with outstanding achievements in the categories of arts, culture, education, invention, science, military, community service, significant personal achievement, entertainment, media, and philanthropy. So this year they had another outstanding list of inductees, and the first one is Haley Brown, who was an educator from 1850 to 1949, William Charge, who was an inventor and a scientist, gave us most of the newest innovative food storage creations from 1898 to 1958. And then we have Mike DeWine, our governor, and we have John Legend, singer and songwriter. And last but not least is William Pitzenbarger, 1944 to 1966, Airman First Class, U.S. Air Force Base, born and raised in Piqua, Ohio. And I just wanted to bring this forward and let you know again, another Pickwood, yes.
I appreciate that. That's great to hear that. I mean, to have a Pickwood in the class with John Legend and the governor, I love that. I do. I think it's great. So, anything else?
That's all I have.
Hey, I thank you very much. So, Mr. Grissom, sir.
I don't have much tonight. I was curious. I know with the 4th activity's been canceled. I understand that the no mass gatherings are still in effect. Was there any update on fireworks? Did we decide on those yet? Do you know?
As far as I know, the mass gathering hasn't changed, and the firing is still undecided. The fireworks
Okay.
are as stand, so
Thanks. I just didn't
They're
know
at
if
a
there was
what?
any update.
we
We're
would
at-
not be having them because of the mass gatherings. That hasn't changed.
Could
The
we
order
decide
is
to
still
have
in
them
place.
despite that? Could we decide to do that?
Break the law, you
Sure. Are,
can't. Obligation as a citizen or as a commissioner to follow the laws of the state of Ohio.
just like other jurisdictions,
I
right?
don't care what other jurisdictions do.
I hear you. Thank you.
But I did want to say, I did reach out with the city, and I want to say they do a lot of good work on the back end, trying to see what the citizens want. I've seen there were surveys went out. I try to share it as well. I'd really encourage people to go in there. There wasn't a
Take the
ton of
survey.
responses, and kind of surprised because I get a lot of comments about what people think we should be doing with the 4th or other events downtown and some of those. So when those surveys are out there, I really encourage people to provide that input through them so that we can provide that feedback. They do a really good job taking a look, taking that advice, seeing what we can do, and to try to make everybody happy and entertaining and a really good event too. So I believe that survey for the 4th is out there. So as we look towards next year, really trying to make it eventful, because I know we can't do it this year, and that's understandable, but looking towards next year, really trying to see what we can do, so.
Thank you. Thank you very much. Commissioner Hines.
Again, thank you, Amy, for your report. That was really good, and I think it will help to give some information for people to really learn a little more. The only comment I have is our city manager, Gary Huff, tendered his resignation in the end of the year, right, December, so he will still be here until December. So, and I just want to say that he has been a fabulous city manager, and he is someone who, ethics are so very important in this job, of being ethical and having the professionalism to do the job. We have seen many times cities who have not had a professional in that position and what can happen. And so I just want to say, having worked with Gary as long as I have been on the commission, that I'm very thankful for the vision he has set forward for our city, the way the staff really respected him and respected his leadership and the managers. And we were very, very lucky and have been very lucky to have him here
Yeah.
to help move our city forward.
Totally agree.
So he, we have a few more months, so he will continue to do that, and we will do the best that we can do as a commission to try to fill those shoes. They'll be tough to fill.
Yep.
But I am just very, very thankful to him, and I want to give a huge shout out to his entire family, who I know are his backbone and his support, and they have been through this with him as well. So we are wishing them all much enjoyment in retirement, and play with those grandchildren, because I know those grandchildren are so very important to him. So that's all I have.
Thank you. For the mayor's report, the first question I've got is, Ms. Brookhart's here for a pool report. Can you give me an update? I'll wait till you move. Seems like there's a lot of discussion being stirred about the pool, and supposedly that it was left in disrepair and that it froze over. Can you give us a report of where we're at in the process? Because I've said several times that we're going to get a design, a person to design it that will either tell us to build brand new or give us options to rehab. And the advisory committee at that point will come in and make advisory, give advice to the commission as to which way to go and how to go about it. But where are we at currently?
Yes, sir. So where we're at right now, as you all know, the city of Piqua requested proposals from qualified consulting firms to conduct a needs assessment and a feasibility study for the city of Piqua swimming pool. This study will enable the city to determine how to proceed with planning and funding of either revitalizing the current facility or building a new facility. We received 3 proposals back from 3 different consultants. One was from MSA Sport, and they have offices located in Cincinnati, Columbus, and also in Florida. A second proposal was from Branstetter Carroll Corporation. They have offices located in Cincinnati, Cleveland, Dallas, Texas, and Lexington, Kentucky. And a third proposal we received was from CHA Design Construction Solutions, and they are located in Columbus. So all 3 firms have locations here in Ohio and have worked with communities like ourselves on looking at pools in our condition, worse or better, and are very well staffed to do this type of assessment. The park board has reviewed the submittals that were given to us. We conducted interviews with all 3 firms just last week.
Yes.
So the park board will be completing evaluation forms on each firm. Based on the park board's recommendation, then we will request a contract to perform the study from the recommended firm. And then we will bring that before you, commission, for approval, and then award a contract to begin the study. I met with all 3 firms up at the pool before we met with the park board so that they could see the current facility and just look at the site and see how much space they had to deal with, what the current condition of our facility was. They looked at all the buildings, just to get an idea of what they would be assessing and what kind of space they had to work with in looking at, say it would be revitalizing that pool and maybe just adding some new features on versus if it would be a complete new aquatic facility and if there would be more space to expand up there. I will say that they were all very impressed with the condition of the pool for the age of the pool. They said a lot of pools that age they walk into are not in near as good a condition as ours is.
Oh, it didn't freeze over last.
No, and it did not freeze over last year. It has been winterized properly every season.
Okay. So-
And it could have run this year
Yeah.
had COVID not hit, and we'd been able to open the pool, we could have. And we still could in the future, if we chose to operate it as is. It is an option down the road as we're in between. So that is something that we could look at down the road. So it could be run if it needs to be. We are maintaining the water that's currently in the pool. I know someone suggested it is green. We do put chlorine in it. We keep a pump inside to circulate the water that is inside the pool so it doesn't become a mosquito infested issue or a pond or anything. So we will continue to maintain that as we need to. I was personally very pleased with all three consulting firms, and I believe the park board shared the same sentiments that we're very confident all three groups were very qualified. I believe you'll see that one firm stuck out to all of us more than the three, and I think you'll see that here in a few weeks. I will have that performance information back from the park board this week, and then I will review that, and I'll get that information back to you as soon as we get that compiled, and we can move forward with a study. One question that we asked all the groups in the study was, that was very important to all the park board members and me as well, is how are you going to engage the community in getting feedback on what do you want?
Exactly.
At the current facility or in a new facility, what do you want to see up there? And I asked them specifically, how are you going to reach every generation that is using the facility? What will you do to engage kids in the school system, the kids that are using the pool, the parents that are using the pool, and make sure that we reach every generation? And what do you want? What activities do you want to see up there? What haven't we been able to offer that maybe we could offer in the future, and make sure that we're able to do that? They all have exceptional plans on how they do that. They will push out web-based questionnaires to make sure that they reach everybody in the community. Asking basic questions, do you like what you have? Would you like to see something else? Are there additional things that you would like to see? And so on and so forth. So I really think that all three firms, they've all done this multiple times, and I'm really looking forward, going forward with this, where we'll be in the end, and we'll see what we're going to do here in a very near future.
I appreciate the update, and thank you for putting out the rumors. So
Yes, sir.
they're out there.
Yes, sir.
All right. Next is another rumor that I want to quelch, that apparently the city's going bankrupt. Is that true, Ms. Holtzapfel?
No, it's not. The city is not going bankrupt.
And thanks to the foresight and your help and city manager's diligent work in cutting the budget, we're well poised is the word I want, at this point, and we're not going bankrupt.
We're not going bankrupt. We're still watching closely all budgets, and we're watching daily the revenue projections and looking to see what grants are available and if the state will in any way be helping. So it's a day-to-day.
It is.
Yes.
It is. And as always, you do a great job, and I appreciate what
Thank
you're
you.
doing. Thank you. All right. Next, I have a proclamation that I would like to read. I know we should have did this at the beginning, but I want to read it now. It's about Juneteenth, and then if you don't know what Juneteenth is, please listen. Whereas June 19th, 1865, was the day when Union soldiers arrived in Texas and spread the word that President Lincoln had delivered his Emancipation Proclamation, and whereas the news travels so slowly in those days that Texas did not hear of Lincoln's proclamation, which had given on January 1st, 1863, until more than 2 years after it was issued. And whereas the proclamation declared that all persons held as slaves within the rebellious states are and henceforward shall be free. Whereas thus the Emancipation Proclamation was limited in many ways as it applied only to states that had seceded from the Union, leaving slavery untouched in the loyal border states, and whereas it also expressly exempted parts of the Confederacy that had already come under Northern control, and most importantly, the freedom it promised depended upon Union military victory. And whereas, although Juneteenth had been informally celebrated each year since 1865, it wasn't until June 3rd, 1979, that Texas became the first state to proclaim Emancipation Day, Juneteenth, an official state holiday. And whereas it is much more than a holiday, Juneteenth has become a day for African Americans to celebrate their freedom, culture, and achievements, and it's a day for all Americans to celebrate African American history and rejoice in their freedom. Now therefore, I, Chris Lee, Mayor of the City of Piqua, do hereby proclaim June 19th, 2020 as Juneteenth Day in the City of Piqua. And I have a proclamation here. If anybody would like a copy of it, I would love to pass it out. I've got it signed and got PDF copies, and if you would like a copy, it's important to me, and it has always been important to me, June 19th, especially for the last 27th years since that is also my anniversary, wedding anniversary. So, but it's also important to me because when I was in high school, before I was in high school, I didn't understand what it meant or anything, and then I took a class from Mr. Hamilton called African American History and learned about it, and it's important, and we want to share our history, and I want to share African American history with everybody in the City of Piqua. So I'm trying to think. I don't have anything else other than that the commission now will adjourn to executive session to consider pending or immediate litigation and to prepare for and review negotiations on compensation and or other terms and conditions of employment for city personnel. I need a motion to adjourn to executive session.
I'll make a motion to adjourn.
Second.
Moved and seconded. All those in favor, say aye.
Aye.
Opposed? We are adjourned to executive session.